The patient had been in and out of hospital for issues unrelated to the coronavirus. But when they were tested at the Royal Berkshire Hospital last night, it was confirmed that they had the virus. The death is the first in Britain, where there are now 116 confirmed cases. The Chief Medical Officer says the UK is preparing to move from the contain into the delay phase of dealing with the outbreak. The second phase means that measures to tackle it will now be ramped up. Our health and social care correspondent, Victoria MacDonald, has this report.
Since the first cases of COVID-19 were found in the UK, it was inevitable there would be some deaths, yet it still came as a shock. Late this afternoon, the Royal Berkshire Hospital said that a patient has died. In a statement, they said,
"Sadly, we can confirm that an older patient with underlying health conditions has died. The patient has previously been in and out of hospital for non-coronavirus reasons, but on this occasion was admitted and last night tested positive for coronavirus. The family has been informed and our thoughts are with them at this difficult time."
Our sympathies are very much with the victim and their family. But the situation is pretty much as it has been, in the sense that we're still, Sam, in the contained phase, though now our scientists and medical advisors are making preparations for the delay phase.
Only this week, the NHS told all 135 acute hospital trusts in England to routinely test anyone in intensive care units who had a breathing problem. This patient is believed to have contracted the virus in England, and contact tracing is already underway. The evidence so far in this global epidemic is that the elderly with underlying health conditions are at higher risk of dying from COVID-19. Like many care homes, Nightingale Hammerson in South London is already putting in place contingency plans.
At the moment, we are mainly focusing on the prevention of any kind of spread or outbreak. We are speaking with the residents, relatives and all the visitors of the care home to prompt them to wash their hands with the soap and water as the most effective way of preventing the spread of coronavirus or any other sort of virus.
Staff were indeed being shown how to wash their hands today, and under ultraviolet light also shown just how difficult it is to remove all the germs.
Okay, you see your ring, your nails. Yeah.
Like anywhere, coronavirus is making headline news.
I am concerned, but I feel just have to put up with it.
So are you worried?
I know more than anybody else. When my time's up, my time's up. So, but I do worry for my young people, my sons.
It is obvious why care homes have to take extra precautions. Elderly people are particularly vulnerable to this virus. So that could mean, if it reaches epidemic proportions, that they have to take hard decisions. That could include preventing visitors coming in or even stopping gatherings like this and keeping residents in their own rooms. MPs heard today that half of all the coronavirus cases in the UK are most likely to occur in just a 3-week period, with 95% of them over 9 weeks, raising questions about how the NHS will cope.
And the bit of the system which will come under pressure first will be those conditions that require people to have oxygen and particularly to have critical care beds. And that bit, I think, will come under pressure at quite an early stage if we have a high end of the range epidemic for this. Wider general services will be much less affected, and I think, for example, children's services, because children seem to be relatively spared from this disease, I think will be relatively much less affected.
With cases in the UK now over the 100 mark, experts say there is evidence of community transmission, that is, patients developing symptoms who have not been abroad. But the majority of the cases are still imported, and tonight the NHS said people returning from anywhere in Italy, not just northern parts of the country, should self-isolate if they believe they have symptoms of the coronavirus.
Victoria MacDonald with that report. Well, joining me now by Skype from Oxford is Professor Sian Griffiths, a public health expert who's an Emeritus Professor at Hong Kong University. She co-chaired the inquiry into the SARS outbreak in 2002 and 2003. Thanks for coming on the programme again, Sian. What is your reaction, first of all, to this very sad news that the first British victim has died of the coronavirus here?
Well, it is sad news, and our thoughts are obviously with the family. But if we look at what our expectations, we did expect the numbers of the cases of the disease to grow. We did, and as they grow, then unfortunately some people will not survive. So it's. I know everyone's saying this is a shock, and I think the reason it's a shock is that we've been in a situation where the majority of cases in the country have come back from overseas. We've been able to trace where they've come from, and that's sort of comforting in a way because you can trace the pattern of disease. When you can no longer work out where the disease has come from, when we've got community spread, that's when anxiety grows, and I think this is symbolic of the growth in anxiety, that we may have more people in the community than we know about who have the disease, just as they found in other parts of the world.
Of course, we'll get onto that in a minute, but this patient only tested positive last night and died during the course of the day. Does that tell you anything in particular?
I know nothing about the clinical nature of or conditions of this patient, so I really can't comment on this case. Okay. So I don't think I draw anything very much just from the facts that we've been told.
All right. Now, we saw in Victoria's report there, lots of elderly people who are, in varying degrees of worry about this. What should elderly Britain's citizens do to protect themselves from this?
The messages remain that we should all be very careful about washing our hands, and that's all of us, and not just the elderly people who, I think I possibly come into that group as well. And, we need to take it more seriously, that we do need to wash our hands properly. We do need to make sure we don't touch our hands and our eyes. We need to take all those containment measures as seriously as we can. And at the same time, I think keeping healthy, that also helps. Right. So that helps to be keeping healthy. All of us need to keep that message, and to keep on with life as normal as possible, whilst being aware that obviously the virus is around. So if we get symptoms, to report the symptoms to 111. That would be my advice. Okay. Because that's sort of carry on life as normal, and the decisions about other things that will happen around us will be taken by local authorities or by the government.
Now, we mentioned Italy in the introduction there. And the number of cases there really is quite alarming. I mean, I think the infections over 3,000, the numbers of deaths, I think 150. Given the increase in cases in this country, is Italy our imminent future? Can we be where they are in 2 weeks from now?
Well, these are questions that one can't answer. It is a possibility. It's probably not a probability. It's a possibility. But I think the appearance of the disease in places like Korea or Italy have been that the cases have. There's been quite a focus for the disease. It's probably been in the community a while before it's been diagnosed. And so it's got a grip. And that definitely happened in Wuhan. The disease got a grip in the community before it was made more widespread. Knowledge of it was made more widespread and the containment measures were put into place. So we have been doing a lot in this country in terms of raising awareness, in terms of preparation in the NHS, preparation in other sectors. So there's lots of planning that's been going on. The real question is, will the plans work when we need them? And, will the pressures be too great?
Indeed. Sian Griffiths, we've run out of time. Thank you very much indeed. Jackie.
Thank you.
Well, earlier I spoke to Jeremy Hunt, the chair of the Health Select Committee and former Health Secretary. I started by asking, now we have moved closer to the delay phase in dealing with the virus. Is that an illustration of just how serious this is?
Absolutely. And it's not just that we moved into that second phase, but there is now very active planning going on for the final phase, which is called the mitigate phase, when we may have to get our heads around perhaps 20% of the population catching the virus, which is the prevalence rate in Hubei province in China, the epicenter of the disease. And so that would be huge in terms of the implications. It's not a prediction, but the preparations are happening for that kind of disruption. And that's why we heard, for example, that they're looking at allowing final year medical students to practice as doctors, or foundation year 1 junior doctors to do things they wouldn't ordinarily be allowed to do. So there is a lot of effort going into expanding the capacity of the NHS.
That does raise the question, are you confident if this worst-case scenario does happen, that the NHS can cope?
I do think the NHS is one of the best prepared systems across the world. I think it came second in the Global Health Security Index of countries around the whole world in terms of preparedness. And it's able to do things because of the centralised structures that other health systems find very difficult, like the decision this week to test all pneumonia patients. So there are some advantages, but the pressures will be very severe.
Yeah, and they're really critical pressure points, aren't they? Because Neil Dixon, the Chief Executive of the NHS Confederation, raises a really big concern today about whether British hospitals have enough respiratory resources to deal with everyone who might get this virus, and he thinks they don't. That's really worrying, isn't it?
That is definitely the biggest pressure point because, you know, this is a respiratory virus. That is how it's spread. And, you know, the part of the population that are most at risk are older people who have long-term conditions affecting their breathing. And so that's what the preparations are being focused on at the moment.
But if hospitals don't have the respiratory resources to deal with that, that is a real danger for those older people who are most vulnerable.
Of course, and that's why they are looking at flexing the treatment. I know there's an enormous effort at the moment to reduce the occupancy in intensive care units to prepare ourselves, but also I think there was honesty from the Chief Medical Officer this morning that, you know, there would be an impact even on some urgent treatments, but he was also confident that a system like the NHS is able to flex the care it gives. One of the points he made was that the peak pressure on the NHS will be for about 3 weeks. So there's a 3-week period when I think things will be very, very difficult. And what I know they will do is to try and make sure that as much treatment as possible happens either before that 3-week period or after it. But timing is therefore absolutely essential.
There is a question about whether the NHS anyway is coping. The National Audit Office today warned that there are not enough for nurses. And that surely is partly because of your failure as Health Secretary to deliver on that.
Well, I don't think it's the time for sort of having party political discussion, but I will answer that question very directly. When I was Health Secretary, I announced a 25% increase in nurse training places, and the National Audit Office did say today that there's been a 5% increase overall in the number of nurses, but it's probably not enough. You know, any health system, when you have a pandemic, is going to be under severe pressure.
On that critical issue of nurses, how do you make sure that we get enough nurses, given that post-Brexit, given that we're in the middle of a coronavirus where countries will be desperately trying to hang on to their nurses? We're facing a really difficult situation here, aren't we?
Well, we are, and that's why the long-term approach is obviously to train more nurses, and that's going to happen. But in the short term, there are lots of things that you can do to relieve pressure, and that's why the government's been talking about inviting back people who've recently retired. It's a very short period of 3 to 9 weeks where you have that big increase in pressure. And so there are things that you can do for a short period to relieve the pressure. But the timing is going to be absolutely crucial.
Are we moving towards a situation we're seeing in Italy, say, where you're talking about closing down schools?
Well, what Professor Whitty said was that is now the live debate in government. And it's a very difficult judgment call for ministers, because on the one hand, although children aren't the worst affected by coronavirus, they do appear to be capable of catching it and spreading it. Weighed against that is that if you start closing schools, then mums and dads can't go to work, and that will include doctors and nurses in the NHS who you very much need to be able to go to work. So it's a very difficult judgment call. We can see what's happened in Italy and in Japan, and I think that's what ministers are going to be weighing up very carefully in the next few days.
Jeremy Hunt, the former Health Secretary there. The number of cases continues to rise across the world. So what is the impact of COVID-19 on other countries? Well, in Iran, officials have announced new measures to fight the spread. Checkpoints are being set up to limit travel between major cities, and people are being urged to reduce their use of banknotes. So far, 107 people have died, and over 3,500 cases have been confirmed. In South Africa, the Minister of Health has confirmed their first case. It's now the 7th African nation to report an infection. The confirmed case is a 38-year-old man who had recently come back from a trip to Italy with his wife and 10 others. A number of sporting events have been affected. England's Six Nations game against Italy on March 14th in Rome has been postponed because of the outbreak. Organisers said the men's, women's and under-20s contests will be played at a later date.